Hello, good evening, friends. We have heard of so many people complaining of what's called as sleeplessness. In medical terms, we call it insomnia. There can be various types of sleeplessness. One, difficulty in falling asleep. Number two, they can fall asleep, but they wake up early in the morning or early in the midnight with severe anxiety, with severe tension, with severe palpitations, sometimes with suicidal ideations also. More often than not, sleeplessness or insomnia can stem because of certain psychiatric conditions like anxiety, depression, schizophrenia, mania, manics. They do not fall asleep at all. They can remain awake throughout the night, mania condition. Then other mental disorders like dysthymia, schizophrenia, generalized anxiety disorder, PTSD, post traumatic stressful disorder, that also can present to the psychiatrist with only complaints of sleeplessness. Post traumatic means some event, some stressful event, some painful traumatic event, emotionally traumatic event may have occurred about say 3 months ago or 1 year ago, and today patient develops only sleeplessness as a cardinal feature, as a cardinal symptom of post traumatic stress disorder. There are certain general medical conditions also which can cause sleeplessness. Number one, circadian rhythm sleep disorders. All of us have certain circadian rhythms. It's a biological clock, biological cycle. We tend to sleep at a proper time, we tend to wake up at a proper time. When this circadian rhythm gets disturbed, like for example, in jet lags, there can occur a circadian rhythm disturbance also. At such instances, people can present with insomnia. Sleep apnea is one condition which has the manifestation of sleeplessness. Restless leg syndrome. We have seen quite a good number of patients of this presenting with only sleeplessness. The syndrome of painful legs and moving toes. We have nocturnal myoclonus, very important disease which can present with insomnia. Then any painful or distressing condition like for example arthritis, chronic heart failure, carcinoma, unbearable pain, etc., unbearable emotionally traumatic pain that also can produce sleeplessness. Dementia also can have sleeplessness. Are there any substances which, when consumed, can produce insomnia? Yes, they are caffeine, which we see in coffee, stimulants like cocaine, alcohol withdrawal, opioid withdrawal. They all can present only with insomnia or with sleeplessness. We have to think of all these possibilities whenever a patient comes to us with complaints of sleeplessness. Thanks a lot. All the best. God bless you.